Good afternoon, everyone. I know we just have 1 hour set aside for our meeting today, so we'd like to dive in and begin our dialogue. Thank you for joining. It's been a couple months now since we've met in this particular setting for HB 413, and it's nice to have you back again. If you are on the working group, would you please put your name and your affiliation in the chat so we can keep track of official working group members? Recognize there's several attendees here who aren't on the working group specifically, but are welcome to attend this meeting. But if you are assigned to the working group, if you could just throw your name into the chat so we can keep track of our attendees, that would be great. Thank you so much for doing that. We do have a pretty slim agenda today. Since we haven't met, like I said, since September, we'd like to go through our meeting minutes, and then we'd like to spend the bulk of our time really on discussing operational updates from our side, and then on the side of the providers as well as the plans, and work through some of those items, and then we can close up at the end with next steps. While we are still gathering here and people are joining, again, if you're on the list, working group, if you would please put your name into the chat with your affiliation. Thank you, all of you who are doing that. We really appreciate that. I'd also like to draw your attention to our meeting minutes from September 16th. Those were distributed and posted online. If you have had a chance to review them and have any comments, would you please submit those to us now for any changes or modifications you'd like to make? If there aren't any, then we can go ahead and take a motion to approve the minutes from September 16th.
Jen, Pat Fleming here. I'll make a motion to accept the minutes as presented.
Thank you, Pat. Do we have a second?
This is Russ Elbell. I'll second.
Thank you so much, Russ. All right, all in favor. If there is a nay, please state so. Otherwise, all in favor, just maybe put up your hand. Okay, thanks so much. Whether that's your virtual hand or your physical hand, appreciate your participation in that. Thank you. Thank you so much. Okay, we're capturing that. And then if we could, thank you, Sharon, for presenting the minutes. We will go right into our dialogue around our updates regarding our efforts to address behavioral health providers' concerns around our UMIC claims. So just to recap where we left off in our last meeting, we had taken a pause on our collective work here around our targeted adult Medicaid population to really work out some existing issues that have really needed some focused discussion around our UMIC claims and claims processing and that program management. And while we had been bringing issues to this meeting, we really needed to just stop and pause and work through some remaining issues between the behavioral health providers and our plans. Since that time, we have had much participation between the behavioral health providers as well as the plans. And we'd like to really spend time now walking through that. And I'd really invite 3 parties of participation. The state has been involved in these discussions that have occurred. And I'll say that I'm going to give the team from the state an opportunity to present an update from our side. But I just did want to recognize that there has been much attention on this topic, and we have seen significant progress. And thank you very much for committing to the work of meeting together. I know many of you have met face-to-face. You've invested significant time in improving these processes and resolving issues. And I think today is really our time in a public forum to walk through what some of these issues are, and then have you share both sides where your perspectives are and where we feel we are with regard to next steps in that work. So if I could at first start with Eric and Greg to give an operational update from their participation in some of these meetings that have occurred. If you would do that, go ahead and I'll switch there, and then we'll move to the behavioral health providers, and then we'll move to our accountable care organizations if they'd like to give an update.
Sure. Thanks, Jen. Happy to do so. So ever since the last meeting, we've been holding bi-monthly meetings, including the UMIC plans and also some of the key behavioral health providers. We've been focusing our efforts on addressing the claim issues that we've encountered. We are getting good feedback from the providers that progress is being made. However, they do still continue to report some concerns. A lot of the plans have been fantastic in their efforts. They've been holding meetings and including the state, which is really good and helpful for us so that we can document these issues and also document the resolutions that we're coming up with. It helps us to be able to keep track and say, okay, are we having the same issue with this provider across all the plans, or is it an issue with this specific plan across all the providers? So it's helping us to kind of track down where it is, what's happening, but also to share those resolutions across the group. Like I said, several of the plans have held meetings individually with those providers, but have also included the state, which has been fantastic. And it's helping us to get a better feel for where things are at and kind of keep track as they're progressing as we move through these meetings. I don't know, Greg, do you have anything you'd like to add?
Yeah, thanks, Eric. Yeah, I just wanted to say that it's been a good experience for us to get together, bring the plans together and the providers, as well as us being involved. The individual meetings have been particularly helpful. It's provided us an opportunity to really drill down into specific issues, map what those issues are, and then our goal from sort of dealing with our emergent, or I should say these immediate issues related to billings and reimbursement, is really to come up with a longer term strategy around some of the things that we've identified that are consistent problems across the board, and then have processes in place that will reduce the likelihood that those issues will come up again in the future. So we're working on two sides. One is sort of the immediate issues that providers have had related to reimbursement and billing, and then we're also working just on the longer term strategies that'll help us mitigate these things in the future.
Great, thank you. And I know it's been our commitment on the state side to have an individual really committed to this work and to serve as a liaison. And Greg and Eric have represented some of the work that Becky has been doing. She's not with us this afternoon, but she's been keeping a very comprehensive list of when these meetings happen, the topics that are discussed. And she's done a really good job keeping an overview of all of the different items and their tracking to resolution. Another important step I think that Greg did point out was that while a lot of individual problems have been identified, one of the concerns that we definitely have on our side is that the process itself is working towards there is a process so that these won't creep up and occur again. So perhaps there's an opportunity for others that will present to speak to those items. But I think that's one of our concerns now as well. We've seen great dialogue and a lot of collaboration and work towards resolving current issues. It's important for us that it's sustained and that these issues are addressed ongoing through a process, a mechanism that will help sustain this work. So with that, I don't know, Brent, if you have anything from our side that you'd like to add, okay? If not, we'd like to turn the time over to the providers to share your experiences, if you would please, and walk through maybe some of these steps, problem identification, steps to resolution, and how that dialogue is going through this time. Would anyone like to volunteer?
All right. I'll do it.
Thanks, Adam. I know I'm trying to put you on the spot. We just really
No.
want to make sure that we're addressing everything we need to.
No, that's great.
for this
I,
project.
To add that to that too, Adam, we want to make sure that what we're seeing is actually how the providers are feeling.
Yeah.
Are we capturing it correctly, or are you feeling completely different, going, nope, they're way off base? That's really what we're looking for.
yeah, so I think Molina and Health Choice have reached out, at least to my organization, and we've held meetings to go through issues, and we've been able to identify systemic problems on both sides to figure some of that stuff out. We're still waiting to meet with Select and the U about that in the same fashion. What I can tell you is that those meetings were fruitful, but it was mid to late November for the Molina meeting and early December for the Health Choice meeting. So we haven't been through another billing cycle really to see if the systemic issues of denials have really changed, but we're able to start going back and cleaning up some of the claims. So that is promising.
So Adam, do you have time scheduled to meet with the other two plans to work through your items with them?
No, they haven't reached out, but I should. I'll take the initiative
Okay.
and reach out to the two of them.
Thank you. Go ahead, Russ.
Adam, we met with your team on a few occasions. Since September 30th, we resolved the EOB issue. That was a really big deal. So I know that our team has met with your team, and I think where we're missing is pulling you into those meetings. So I think we better do that from now on. So I apologize that you weren't included.
That's great. I know Brian has been meeting monthly, but there is some still systemic stuff that I think we need to address. So I think it'd be helpful to just have a meeting with me and some of my clinical people as well. So
Okay.
That'd be great.
Yeah, that'd be great. And Adam, I would really appreciate it just if you would send me an email and maybe let me know what those systemic issues are, because they're not coming up in the meetings that we're having with your team, your billing team. So thank you.
Yep, no problem.
Thank you. Nelson?
We could. That's easy. We compiled it already for Becky, so we can just give you all the data. So that's great.
Thanks, Adam. Thanks, Russ. Nelson?
Yeah, this is Nelson from Healthy U. And Adam, we have had meetings going back quite a while, regularly scheduled meetings to go over any issues, and they actually get canceled quite often because there aren't any outstanding issues. Brian is someone that we meet regularly with, so maybe we need to pull you into those meetings as well, because maybe it's just not filtering through to you that those are happening and that there's kind of regular communications between our provider relations and your team.
That would be great. In the same fashion as what I said to Russ, I think it'll be helpful if Brian is not communicating appropriately about it, then I would love to clarify any of that, or maybe he's communicating it poorly to me. So I'd like to resolve whatever we need to. And it's not that I don't believe that both of you guys want to resolve it. So.
Yeah, if I may interject, I know Patrick's got his hand up. I'm sorry. Just one reminder that as you have these meetings, will you please involve Becky Johnson at the state side? We want to make sure that we can track all these. That way we can show progress that's being made and we can keep track of it. And that way we're not just hearing like anecdotal stories of, oh, we had this problem, because if that problem does get resolved, we want to credit that that problem has been resolved and keep track and show that definite progress. So that would be most helpful. Thank you.
Great, thank you. Adam, I know you went off camera, so I'm guessing your part is done. Pat, if you'd like to go ahead and give your feedback, that would be great.
Yeah, Jen, thanks. I haven't been on that committee, but when we start talking about this originally, the idea came up is just to do the payment after the billing's in and then adjudicate it later. Because all the ACOs have ongoing relationships with all these providers, and so recoupment of any money can always happen in the past. And I'm wondering is that something that's still in play, or are we not thinking about that? I'm worried about some of the small providers and just the ability for them to make payroll, because Medicaid is such a big part of their revenue now. Anybody? Do you understand what I'm talking about?
Yeah, no, I absolutely understand what you're talking about. So I know that Molina has made that offer to do like a kind of a payment up front to make sure that the cash continues to flow as they work through the issues. So that's what I have from the notes that Becky provided me, but Molina has made that offer.
And we still, we'll still stand by that.
Yeah, and I'd like to, I wonder if Russ helps Joyce. I wonder if you've even thought about that, Russ.
Yeah, we have. In fact, we've made the same offer, Pat. And so I think, Pat, when we talked about this originally, we were talking about the specific issue was residential services. And that's what we understood from, conversations with Tim that Salt Lake County does. And so we've made that formal commitment, particularly if we're moving towards TAM, where almost so much of that work is in residential.
Okay. Thanks.
Thank you. Any other feedback the provider group would like to share?
This is Jed from Weber. We've had meetings with Healthy You and Health Choice so far, and we're just waiting on the other two meetings. I don't think we have those scheduled yet.
Okay. Thank you, Jed. Could you share how those meetings are going so far?
Yes, very well, although we really don't have very many claims with those two ACOs. We have more with Molina and Select Health for sure.
Okay, thank you.
And this is Brian. Don't we do a regular scheduled meeting with Weber every couple of weeks?
So we have a clinical discussion every month with both Molina and Select Health, where we just discuss clinical cases, but not necessarily other issues.
Yeah, I've seen a number of emails talking about our payments where we've made some errors on some payments. So let me go back and look at it. But
okay, great. Yeah, Michelle Jensen, the person at our,
that's who we've been meeting with.
That, and I just barely asked her, and she told me that we hadn't had the formal meeting with Molina or Select Health.
I mean, again, we would love to do a face-to-face if that's possible, but I know we continue to meet and to get emails coming back and forth on claims, but let's do that. Let's set up a face-to-face. That'd be great. Thanks,
Brian.
Can you guys hear me? Hello? No? Okay.
We can hear you.
Now we can hear you.
Oh, you can? Okay.
Yeah.
So this is Nina for Salt Lake Behavioral Health, and we have had a fairly formal claims meeting with Molina. They kindly had a number of their executive team there. What we've discovered on our end is we don't have a ton for too many of the ACOs of specific unpaid claims. Unfortunately, during our Molina meeting, our billing person in Denton had an emergency and couldn't join us to kind of go over all the, any real specifics. So we're still working on that. I also have a meeting set up here at the hospital with through Chase. He came by, and we have a meeting set up with his team. One of the things that happened, and I know a number of the providers have talked about it a little bit, is there may have been a slight confusion over these meetings, because some of us were left with the impression that we were going to set up meetings for them to come to our location so that we could build relationships, get to know people, their administrative teams, have really good understanding of kind of the continuity of who to reach and who does what, which is one of our primary goals. And then it got changed into more of a claims processing meeting at their locations where they just want to go over claims. So from our perspective, that's useful, but we're still on more of the general processes, having access, knowing who to talk to side of things, having that relationship so that if we do run into a snag, we're not just playing ping pong back and forth with claim denials and resubmissions back and forth. We need that hierarchy. So I apologize to Melina. And I think going over that kind of data is probably very helpful from their desire to meet our goals. But I would also say it was very, very useful to also be able to reiterate kind of some of the frustrations that come when you can't get past go, and the specific analyzation of a claim and like who to go to next, and some general trends of frustrations, kind of the everybody internally within a facility being the one, or not a facility, excuse me, an insurance company being the ones that self-monitor. And again, us still looking for some sense of opportunities to have things looked at from a different perspective. The meetings that we're having here is just incredibly illuminating and helpful. And we have gotten, I feel, so much further and so much done by being able to talk amongst each other, all different levels. And I'm almost sad to think of that not being there anymore. So we want to make sure that the conclusions of this, because we've had some meetings like with UBO, and our talks are, well, what do we really want from this? Like, what are we really trying to achieve? And again, we'll get back to that part of the specific processing of claims and where things break down. But the other part of that is this general system access and accountability. So I think the two agencies so far, I've not heard from Select Health, but we usually don't have too many issues with Select Health. We kind of have some structures there in place that work. But the U of U, I would still like to reach out and perhaps have a meeting with them. And like Andy, I'll take the initiative on that. I've not done that.
Thanks, Nina.
Thank you.
So just real quick, and I know Christine, you have your hand up, but what I heard you say, Nina, is that really you've been in a lot of claims processing discussions, and you wanted to go beyond that, to really look at more thorough process itself and how we build relationships to do better problem resolution. Right.
Mm-hmm.
So I appreciate that. And I do feel like that's a little bit of what our state's position is. The state's position is as well right now, is that we've seen a lot of problem solving with regard to the issues that are presented. But again, kind of building that more sustainable model of being able to like maybe have continued dialogue ongoing. And I think that highlights sort of our observations as well. So thank you for sharing that.
And if I could just add one thing, I think it's important to say it has not gone unnoticed, the willingness of insurance companies to work with providers. I think this has kind of been an eye-opening experience for them as well, to be fair. And their willingness to say, hey, come talk to us, help us with this, is very much appreciated.
Thank you. Christine.
Yeah, this is Christine with Health Choice. I know there's been, in a few of the meetings lately, there's been the discussion of having a contact list for the provider so they know exactly, have a list, an updated list monthly, I think it was, or quarterly. So I'm just wondering, are they wanting that to be on our website, on our provider portal? I mean, what are the providers' feedback on making that we put that in a place that's most easiest for them?
Would some like to give feedback on that question? Thanks, Christine, for it.
I'm thinking about that. I think that's pardon me, a good question. And I'm just thinking about the different insurance companies and where we go to find information. One of the things that's also helpful, and I don't know if this is possible, but have it, I think in the portal, the provider portal is where we tend to go to look for manuals and instructions and so on. So I think that would be a key place. Also, just the idea of perhaps a newsletter when things change. I very much love the ones we get from the Division of Medicaid. They keep us all in the loop. So something like that, when there's significant changes that affect providers and changes in department leadership relating to claims and authorization, that would be helpful.
Does that sound like something the plans can do? Something Nina put out? Is that the type of work you're willing to do, and or do you have other ideas of how you could meet that need?
This is Christine from Help Choice again. And yeah, that's absolutely something that we want to do. Like I said, I know it's been brought up in a few meetings. So we do want to make sure that we keep that information updated. We just wanted their feedback on where's the best place for this. So that's very helpful. The provider portal, our provider newsletter that goes out. So yeah, we will absolutely, keep our providers up to date on who the easiest best contact is.
Okay, thanks, Christine.
I think one thing that would be helpful for us at the department is to also have a list. So of these key contacts that are established, that are go-tos for providers to deal with specific issues, if the department can also have that comprehensive list, it helps us know who should be helping providers if we actually get feedback or calls. The other thing it does is it allows us to share that with other providers so that additional providers don't have to go through the process of trying to figure out who would probably be the best person to deal with specific issues. I think the other thing on a specific contact list is that we've also been discussing about key go-to points, because they're right for providers. Sometimes just contacting customer service is challenging, and trying to get specific things resolved can be difficult if it's just a main number. And I think one of the things that's happened through the individual meetings that have occurred is an exchange of, okay, so if you have this particular issue, this is who you contact, right? So some, it may not be the normal channels, but it may be some specific individuals who know what the issues are, know how to get issues resolved, are keen to maybe some of the issues that have occurred before, and therefore they have a sense about how to troubleshoot things if they occur. So I think that would be really important.
Okay, thank you, Nina. I know, Scott, you were on, and then it looks like maybe Scott dropped off. I don't know if you've been able to rejoin, Dr. Whittle. Okay, great. Go ahead.
Thank you. Thank you. I just wanted to echo, I think Nina touched on a really important point. This has been fantastic. It's been necessary. We need these connections. It's interesting that, there's still this complexity to get it right. And I think it's wonderful. And Nina's point that the goal of all this is to get to that quadruple aim, get to where we're actually really accomplishing what Medicaid is built to accomplish. And I just want, certainly not to be a downer, but the really big lift of things like data sharing, things like collaborating more effectively, things like moving into a value-added space. I think we all are on the same page that those things are still kind of the desire of the group. And that this, just to be clear, that this isn't that, that this is the doing business so that we can move into a managed care world and do so without serious pain and without, the different parties in the discussion getting hurt. But just to be very clear that the other steps that would really take us into that quadruple aim are the steps that relate to data sharing, agreeing upon specific goals, agreeing upon how we measure those goals, then agreeing how we value those goals into some kind of value-based arrangement. And so, again, I don't want to be a downer at all. I love the discussion. I think it's absolutely positive, but just to put it into context of what it is and where we are.
Yeah, thank you for that comment. And I do think it aligns with some of these, key operational pieces that are necessary to get to that next level, right? So I appreciate you recentering the conversation around that and making sure that it is our intention to go to those higher levels, right? So addressing these, I think, is really, really important. Are there any other providers who would like to share their experiences? And then we're going to turn it over and let the plan share their perspective. Anyone else? I know there are several of you here on the call. I want to make sure your experience is represented. Okay. Thank you very much for that. Let's pivot over to have the plans give their updates on the work they've been doing with each of the provider groups, and would welcome whoever wants to go first can start. Want to dive in? We'll just have the four plans give their updates.
Jen, I'm happy to give an update for Select
Thanks,
Health.
Russ.
Yeah, thanks. Since our meeting with Representative Dunnigan, few actions that we've taken to improve. One is we've got a designated contact and a team wrapped around the issue. So Allie Warcup, who's on the call today, is lead of that team. Stephanie Osmark, who's in constant contact with providers, is on that team as well. And then we've got a kind of a multi-department group wrapped around every issue that comes up. We've also started to really hone in on key metrics to make sure that by provider group that we're getting claims processed in a timely fashion. So what we can see is, as we've done that work, is that 94% of claims are getting processed within 30 days, 99% within 60 days, and the state requirements are 90 within 30 and 99 within 90. So we're exceeding that. We've developed a dashboard where we can actually drill down and see by provider group the types of denials. And so we're looking at top denials and then starting to see which parts of those can we address. And we want to bring those to the clinical collaboration committee meeting and actually have discussions around those. And then specific issues I mentioned before, that came out in previous meetings, the EOB issue that's been addressed. There were some issues that were brought forward about group therapy being billed on the same day, and individual therapy, and those being rejected, and some care management services being underpaid, and we've addressed those, and those are resolved. And that's kind of the update. And then, we've met with several provider groups. We're hearing the feedback here that you want a formal meeting that probably involves the CEO, CFO, billing. We think that'd be great. And we're also looking at having some group meetings at the start of the new year as well. So we appreciate everybody's patience with us.
Russ, thanks for the report out. Any key learnings that your team has had? Looks like you put a lot of good infrastructure in place that will, as we have more time. It seems like the meetings were just in the last maybe month or so, right? So I'd be looking forward to hearing sort of how you built this wraparound team, and also resolving some of these issues that they're kind of sustained going forward. Is there anything your team's learned through this process?
Yeah, I mean, what we can see is that, one of the things we've learned is a top denial reason is because of there's other primary insurance, and there's no EOB from that primary insurance. And so what we actually are doing is drilling down into that then to say, are there certain services that we would never expect to see an EOB on and therefore should have just been paid? And then are there others, though, that there absolutely should be an EOB because commercial insurance, for example, does cover that service? So we're just in the beginning of that, but we are seeing that there are opportunities on some codes that they should just pay. We're going to clean that up. So that's one thing we've learned. We've also seen, some services where we really, just to be honest, there needs to be a state discussion around the service and how it should be paid. And we think those are the ones that should go to the clinical collaboration committee. So there's a couple of things that we're learning.
That's great. Thank you for that.
You bet.
Feedback, Russ. Any questions for Russ or any additional things to bring up with Select Health?
I was going to say, Russ, are you finding commonalities that seem like across plans, or not plans, but providers, like we're having the same issue across with multiple providers, or do they seem to be unique based on each provider?
Well, I think it's a combination of both. So when I talk about those top denial reasons, those are across all providers, but then there's the next level down, Eric, right? Which is across all providers, who's it happening with most frequently? So that EOB one is the one I'd say is that's just the top denial reason. It's the most common.
Okay, thanks.
Okay, any other questions for Russ? Okay, great, thank you. Who would like to go next? Brian and Christine, I see you're both on. Either one of you want to report out?
This is Christine. I can go if you'd like me to.
Great.
So, as a lot of providers have brought up, our provider relations department has been setting up quarterly JOC meetings with the providers to discuss issues and concerns and problems. And we've also been including Becky in those meetings. And I think they've been really helpful. Our provider director did say that they have not yet connected with Southwest Behavioral, and that's the only PMHP that they have not yet connected with. And they're working to get that taken care of as quickly as possible. We've set up some additional monitoring, and we now have a biweekly denial report that comes to our claims manager and lists denial reasons for any PMHP claims that are denied. So we're reviewing this as a committee, as an operations committee, and monitoring to make sure that those denials are accurate and that we're addressing them appropriately. So we've definitely pinpointed and working on monitoring more and making sure that we're fixing the issues that are coming up. And for us, it seems like the issues have been individual to each provider, that it hasn't just been across the board, oh, this is something that, that Health Choice needs to correct. It's that with every provider, it's been something different that we need to correct.
No, that's helpful. Thanks, Christine, for anticipating my question.
Sure.
For us, it's kind of the same. We're having different issues with different providers, and in a lot of cases there are issues, but they're issues that we have to resolve individually with each group. But I was thinking I would go last, partly because our claims and our provider staff are all on PTO today, but also because, like Adam said, we've kind of got to a point where we've identified what we can see are all the issues, and we've met with the groups, but the claims haven't gone through that claims payment cycle yet. So the proof will be in the pudding here in the next little bit. But yeah, happy to still meet with individuals with different groups. We can set something up with Weber, and if there are any others that we haven't met with, happy to do that as well. They've been very fruitful meetings for us, and as they mentioned, they are learning experiences, I think, for both sides.
Thanks, Brian. Anyone have questions for either Christine or Brian that we'd like to discuss? Go ahead, Nina.
This one was for Christine. I was just curious. You mentioned that the analysis of the claims was done for the, I believe, for the primary prepaid mental health plans. Are you, or do you analyze any of the other claims by category, such as acute inpatient behavioral health or outpatient denials?
You know what? I'm not sure that those are being included, but you brought up a really valid point that we should include those in there. So I'm going to make a note and see if we can have that pulled in our queries and review those as well. Because I know, we want to fix those issues also.
That would be wonderful if it's something that's you're able to do, because we really are sort of the redheaded stepchild in some ways in these discussions, acute inpatient, and yet we very much need to make sure that we're all aligned as well and fix our billing issues if they're coming from our end as well. And I think that would help highlight what we need to do better as well.
Agreed. Thank you for the recommendation. I will definitely have that added.
Okay. Thank you.
Jan, this is Don again. May I make a comment?
Yes, Representative, go ahead.
Oh, okay, thanks. So first of all, Russ, thank you for sending me that report. And I also like the report that you just gave where you're seeing that there's, secondary payer or waiting on the primary payer. And I like the parts where you said, instead of just saying, we're just going to keep denying those, trying to figure out if some of them, they likely never would be the responsibility of primary payer and actually trying to solve the problem. So I think that's terrific. And I'm sorry I got on the meeting a little bit late, but I know that Melina has met with a number of providers. And I got a report from Russ identifying at least the specific issues of our last meeting. And I'm just wondering, maybe you've already said this, I apologize if you have. Has the U been meeting with providers as well?
This is Nelson from the U, and we have been meeting with providers, and we'd be happy to meet with other providers. We have regular meetings with Odyssey House and First Step House in Valley. And I guess Adam has not been in on those meetings. And so I sent an invite to Adam and he sent me a list of some of his concerns. So we're going to have Adam as part of our provider relations meetings where we review billing issues. So yeah, we do have provider relations meetings.
Okay. All right. Thank you for reaching out. Okay. Thanks, Jen.
You're welcome. And in fact, the university was going to give an update now too. So Healthy U, if Nelson, if you'd like to give your update, that would be helpful for us as well.
Sure. I just wanted to note that some of our provider relations meetings, I've been IMing back and forth kind of furiously with our provider relations team, but we've been having some regular meetings since 2020 with some of the folks since some of these problems have cropped up. I know it's been kind of a long time. And just working to resolve them. Some of the things that have cropped up, we've had a lot of problems around some of the DHHS certified providers, peer support workers, caseworkers. Those have been a lot trickier to bill for, and those are a lot trickier, especially when we're a secondary payer. And like Russ said, I think our solution is to not require a denial from the primary insurance. That's something we're working on, because most insurance companies will not even issue a denial for those because they never pay for those codes. So we're working on just doing a bypass for those because we just never get, those just never even get denied. They don't get adjudicated at all. We did have a SWAT team. We call it the SWAT team, and it met weekly. It's down to monthly now, and we're going to be moving to quarterly just because of a low volume. Although it sounds like there might be some more things from Odyssey House that pop up. So we might stay at monthly. We might even up that if we feel like we need to move it up just to make sure that all of those are taken care of. So we have kind of a multidisciplinary team that's dedicated to adjudicating claims or provider issues, because really it takes people from all different departments of our organization. And we're very motivated to get those down because it's at 8 a.m. on a Wednesday. So that's motivation for us not to have that meeting. But we feel like we've been pretty successful so far. So, we're doing a lot of work on it, but I think we've got some ground to make up. And it sounds like Adam has a couple issues to bring up. So we're going to be working on addressing those. And I have invited him to our next provider relations meeting on the 28th.
Thank you, Nelson. Brent?
Yeah, I will be there, Nelson. And I did send you like a snapshot of list of example claims that have been denied. So that'll be a good starting point for that.
Yeah, meeting. And I hope to review those so we've got some answers for you, not just, I appreciate you sending those. Thank you.
Nelson, this is Brent. You identified that some of the certification, the certified folks that we certify are causing some problems. Are there things that we could do differently to make that easier?
I'm really hopeful for the web lookup to look up the certifications. I think that early on, we were getting spreadsheets with a list of who was current on those certifications, and it was just a murkier process than we were used to looking up DOPL certifications. So I think that it's actually gotten a lot better, but that was something that we really struggled with at the beginning of the integrated plan. So I think that it's actually been good, and I think that a lot of your team was really responsive, but you know, we just were not used to, here's a spreadsheet of these folks, and sometimes they weren't as up to date. But I think there's going to be a web interface that we can look those up now. So I'm very hopeful that that's going to solve a lot of our problems.
And I think it's live for some of them. They're currently transitioning those systems over to what we call MLO, which will be an online lookup tool. So I hope that helps. But it's helpful to just hear what the problem was, and it was just identifying who's actually certified. So hopefully we're going to do a better job of that. Thank you.
Well, I just think having that single source of truth is going to be a big deal for us. So yeah, thank you.
Thank you, Nelson. Eric?
Yeah, Nelson, have you guys been including Becky Johnson in those meetings?
We have not, but I also included her when I added Adam to our meeting on the 28th. So
Great.
Hopefully she can attend.
Yeah, that'd be great. We, like I said, we just want to be able to keep track of it so that we can document the progress. Thank you.
Yeah, I'm not sure December 28th is the meeting everyone wants to attend, but hopefully she'll be available.
And then Dave, if you'd like to comment, go ahead.
I just put the link in the chat. That is live. You can look up the TCM and peer support certifications online now.
Okay, thank you. So if you'd like to look at that resource, Dave did put it in the chat.
Jen, could I just add one thing that
yes,
people should always feel free to reach out to me, and if I can't solve your problem, I can get you to the place that can and at Healthy You. And I'll put my email address in the chat box. So if you ever have a question for anything at Healthy You, please just reach out to myself. Leah's out this week, but you know, she's a great resource as well, and so is Julie. So any of us are more than happy to get you to the place that you need to go.
Yeah, and I just want to quickly jump in here too and say we hear a lot that the providers don't know where to go to escalate when they're running into issues with our claims and provider relations. We would really like where is the official place that we can put that so everybody knows exactly who to call? Like, where do we where do we put that?
Do any of the providers want to give feedback now, or do you want to think about that and we'll put it on our list to make sure there's follow-up with regard to where that resource would be most beneficial? If you'd like to share now, go ahead. Otherwise, we'll put it on our list.
I guess I have a question about that. When they say who to speak with, that can have a couple different facets to it. So perhaps having a list on the provider portal of, you know, who's primarily responsible for different types of issues might be helpful.
Thank you, Nina. We'll put that on the list and make sure there's dialogue about that, and then there's an agreement. Okay. Any other questions for Healthy You? Okay. So recognizing that we are in agenda item number 2, this was really this is our priority. And we really find that it's most important that the operational issues and the items we discussed today have moved down a steady path of development, and really wanted to bring this group back together today to be able to talk about where we're at, make sure we're all on the same page, While it's still, of course, important for us to talk about the proposed models for HB 413, and we've invested significant work in that already, we are committed to really addressing and resolving the operational issues to the satisfaction of the involved parties. And it does sound like the conversations to date have been quite productive and constructive as well. And I want to thank you all for that. But it does seem as though there still need to be some ongoing meetings, as well as time for the groups to meet, as well as a little bit of time to just let the process be in play before we move into more discussion on item number 3, which is the proposed models for the TAM population. So I'll let you know that's the direction we feel this is at right now. Representative Dunnigan, if you're still on the call, I'd like to hear your thoughts on where we're at today and what you think next steps should be.
So thank you. And I'm just going to ditto I am exactly what you just stated. That's where I am. I think some wonderful progress has been made. I appreciate the providers being willing to reach out and express their concerns and the plans to try to address those and develop a mechanism. And now I just think that we need to have more dialogue and then see if we can get the system that's going to work.
Great. Thank you, Representative Dunnigan. What other questions do you have? We have time set aside now for Q&A. We know that there's been ongoing work on item number 2, the operational issues. We will commit to being engaged in that work and capturing it, documenting it. We've already seen some great successes. We do have a meeting scheduled for February 3rd to loop back on this topic. Are there other items to bring up today? Other things you'd like to discuss in this meeting now that we should cover?
This is Nina again. I'd like to circle around back to my idea of when we're talking about these different proposals, also what each of the ACOs feel like they could bring to the table in terms of being able to meet, not only the basic, the medical needs and the behavioral health needs, but how they're planning on integrating those, maybe some information on what teams they have in place, what they're planning on putting in place. I still feel fairly strongly that when folks are bidding on something, they kind of bring a proposal to the table of not only, and I understand that they have extensive experience already, but this is a real specific population with specific needs. And I would still like to see something in writing that they bring to the table that we could talk about a little bit as we're making some of our decisions.
Yeah, that's great. So as a future topic, when we re-engage in the HB 413 models, you'd like to dive deeper into what that benefit design will look like. Yeah. And actually, I appreciate, Dr. Whittle, your points. Those are our objectives in designing the care model for this population, right? So I think that was definitely an element of our earlier discussions, and we need to be thoughtful on how we'll build those pieces in. So thank you for bringing that up. Anything else others would like to share? Okay. Well, we appreciate your time today. There was a lot of dialogue shared in this meeting, and important that we capture the minutes. So we will take those, and thank you, Sharon, for doing that work for us, and make sure that you're able to review them for accuracy and completeness, and active ongoing work here in between now and our next meeting. We did take a little bit of a hiatus just simply because of the beginning parts of session. We're happy to dialogue about an earlier meeting, but I think this is about the right time for the plans to meet with the providers and to have some operational practices in place. If you have interest, otherwise, you're happy to reach out to me and discuss that. But yeah, we'll have it scheduled for February 3rd as our next meeting. Okay. Okay. Thank you, everyone. Appreciate your time today. Have a good day.
Thanks, Jen.
Happy
Thanks,
holidays,
everybody.
everybody.
Bye. Happy holidays, everyone.